The Health and Social Care Act emphasises the need for integration. A core vehicle for delivering this will be health and wellbeing boards. These boards have a statutory duty to identify local health and social care needs, creating a more integrated approach for delivering health and local government services. They bring together commissioners across the NHS, public health and social care, with elected councillors, members of the public and representatives of health watchdogs. Could this be a chance to create the holistic system that many argue should have existed from the dawn of the welfare state?
Well, our welfare state is based on a very 1940s assumption that you can distinguish between people who are sick, who are the responsibility of the health service, and people who are somehow merely frail or disabled, who we describe as having social care needs that are the responsibility of local government, and people are means tested and pay towards the cost of their care. I'm not sure if that distinction ever made sense, but it feels increasingly unfit for purpose in the early 21st century, given current demography. And that's why we're asking health and wellbeing boards to join up services, and why we're asking frontline teams to integrate care so that they can match the complexity and the joined-up nature of people's lives.
I think the biggest challenge will be that they are seen as doing the nice, fluffy, community-based stuff. That is about really good things, but doesn't actually change systematically the pattern of commissioning and delivery of services in a new way. And for them to work, the clinical commissioning groups and the local authorities and the elected members need to really recognise that they're the local hub of decision making. And that's going to be an interesting process when the NHS Commissioning Board is still very clearly saying that it will be performance supporting the clinical commissioning groups, and that's a tension that I think can be managed, and it will be managed when the health and wellbeing boards deliver real change.
These are new creatures. We're just finishing some research based on the experiences of 50 health and wellbeing boards as they're developing, and actually I think we would incline more to the glass half full view of health and wellbeing boards. We think they are a very positive opportunity within this rather complicated new architecture that the government's putting in place to really bring people together.
Manchester GP Robert Varnham is Joint Chair of Integration on the NHS Future Forum, an expert group that advises the government on the modernisation of both the health and social care systems.
We've heard a very clear message from people about health and wellbeing boards that most people in the country actually welcome the opportunity to have a space where commissioners from the local authority, from health, can meet together with the population and patients to discuss what's necessary, to agree priorities and to join up what are currently some fairly disjointed services. We've also heard consistent concerns that there are potential barriers which will make it difficult to build those relationships of trust, which are going to be the currency of helping to design these new systems and commission them. And some of the barriers which people have expressed concern about are that health and wellbeing boards may not have enough time to form relationships before they get on with the business, that there may be political interference or a committee structure kind of expectation, and that people in local authorities say sometimes we tend to be a bit too committee focused, and people in the NHS say sometimes we tend to be a bit too command and control or micromanaged. And actually people are giving us a really clear message that there's an appetite to collaborate, but that freedom is going to be the means by which we get better, more integrated commissioning.
Shadow health and wellbeing boards are already being developed around the country. One of the challenges is to create a new working structure without compromising existing good practice. Birmingham has already made real progress on integration. Director of Health and Wellbeing and Head of Services for Carers, Alan Lotinga, is anxious to carry on this success.
We now have the biggest and most comprehensive pool budget for health and care, I believe, throughout Europe in relation to people with learning disabilities and mental health problems. That amounts to over £300 million per annum. It clearly affects an awful lot of people in Birmingham, and there have been quite considerable improvements over the last 2 years where we had a formal arrangement around those activities, including saving money.
Jon Glasby is Director of the Centre for Health Services Management at Birmingham University and has been working with the local authority to determine the shape, style and effectiveness of the Shadow Board.
We were advising the NHS Future Forum at a national level and doing lots of work with health and local government around the country. So we were able to facilitate the process, but also to provide input and support based around the research that we do, the consultancy that we do, and the networks that we have nationally.
That's why we worked with the University of Birmingham in relation to having workshops with elected members, city councillors, representatives of the leading general practitioner groups, the third sector, and patient and public representatives, and one or two key officers, to actually, what I'd say, describe as road tests, some specific scenarios. One scenario might be, you are now a Health and Wellbeing Board, it's 2013, you have £40 million to spend on something called a prevention budget. How would you decide what your priorities? What evidence would you require to come to those decisions? What would you expect from others, not just in the board but elsewhere? How would you communicate that?
We encourage people to ask how relationships had worked in the past and about the kind of structures they'd had, and then to think about how fit for purpose those were in the current and the future policy context, and to think about the kind of health and wellbeing board they would want to have, and design with those kind of aspirations in mind, rather than starting necessarily with the governance and the process and the structure and thinking about membership and constitutions.
Board membership must include members of the public, like Enid Syed, who has spent much of her life caring for her mother.
So I was a carer from the age of 9 for somebody who had schizophrenia, so I spent my whole life caring for somebody. People just want services, they don't want health boards and wellbeing and clusters. They just want to know the GP's there when they need them, and they can have support. The same with social care.
South and Central Birmingham is represented on the Shadow Board by Dr. Andrew Coward. The new structure challenges GPs like him to engage with the wider community as never before.
Working with the Health and Wellbeing Board has opened my mind. For the first time in my involvement in management, we really are trying to work out how we can take this very seriously, so we don't just indulge in tokenism with regard to our patients or population, that we really engage and see ways forward. There are some very, very difficult decisions to make. If we make them in isolation, it's going to be a disaster. We need to make them alongside our population.
One of the great challenges facing the NHS and the care system is that we want people to take more care of themselves. We want them to think about their diet and their exercise and their smoking and how much they drink. So actually engaging with the public and not just having a meeting is really, really important. So health and wellbeing boards really need to think quite imaginatively about how they do that.
Birmingham's Shadow Board has taken this to heart and is already proposing initiatives on local issues.
We've got a lot of obesity in Birmingham, and when we've got a lot of obesity, that can lead to more health problems, like people having strokes, heart attacks, and also taking resources, filling up hospital beds.
23.1% of Year 6 Birmingham children are clinically obese. Now, there is no way that the health service can tackle that on its own. It needs to work alongside the local authority.
So what we're going to do in Birmingham, we're having a health weight loss challenge, and they want Birmingham to lose equivalent to 2 to 3 double-decker buses of weight.
Clearly we'll need to work very closely with the local authority. It will have a lot to say about how schools function and how the health service functions. So you see that synergy that's needed. Now, what I hope is that we can create that in the Health and Wellbeing Board, create more of a pride in Birmingham, and create commissioning intentions that we can put into our commissioning plans.
Well, the benefit of a local system is it allows you to do things differently in order to meet the very different needs of local people. So the way you'd organise services in the middle of Birmingham is very different to how you would do it in Basingstoke or in Berkshire. What we try and achieve, I think, is equality of outcomes rather than necessarily equality of inputs. And in the past, we've tried to treat everyone the same in public services. And of course, if everyone starts off unequal and you treat everyone the same, at best all you can do is perpetuate the inequality. In an ideal world, we'd be able to design differently at local levels to try and get the same outcomes for everybody, but recognising that you'd need to do that very, very differently in different localities.
Around the country, the final shape and effectiveness of health and wellbeing boards won't be entirely clear until their formal introduction in 2013. The more immediate challenge is maintaining good services in a harsh economy.
There is a huge risk, more than ever in these current times, of negative things happening through unintended consequences of decisions being taken by one agency, say in the NHS or across local government, and not thinking through the consequences of those decisions. For example, cutting this budget or disinvesting here or changing fundamentally this service provision. And I would suggest that the Health and Wellbeing Board, initially a shadow board, is the one organisation and group of influential people that can really help minimise the risk of unintended consequences happening across the system.
The risk in the current policy context is that joint working becomes even harder than it was before as budgets get tight and as structures change. But for exactly the same reason, joint working is even more important now than it ever was. And if ever there was a time for frontline professions and practitioners to stand up and to be counted, to make relationships work at a local level, to see the world in broader ways, and to develop new ways of working alongside other agencies and other professionals, that time's now.